Alma Lasers is proud to introduce the Soprano XL diode laser system for hair removal. The Soprano XL dual mode system launches a new era in hair removal. The Super Hair Removal Mode, SHR, is a revolutionary new approach for improved effectiveness and comfortable hair removal, dramatically changing the way laser hair removal has been performed for the past 15 years. The Soprano XL also includes the traditional higher fluence hair removal mode. The Soprano system is cleared for all skin types, including tanned skin. In this video, we will demonstrate the system operation and treatment procedures for both Soprano XL modes. First, let's see how the Soprano XL system works. The Soprano XL's revolutionary SHR mode provides an ideal combination for efficient hair removal. The SHR mode uses the optimal hair removal wavelength of 810 nanometer diode for deep penetration into the dermis, where the hair follicle is located. The SHR mode has consistent, high average power capabilities to enable the 10 pulse per second repetition rate for hair removal in motion. The SHR mode enables a low-fluence, in-motion approach for virtually painless hair removal. The SHR mode utilizes this series of low-fluence, high-repetition pulses to increase the temperature of both the hair follicle and the surrounding nourishing tissue to 45 degrees Celsius. This more gradual, in-motion heat delivery uses the chromophores in the surrounding tissue as reservoirs to effectively heat up the hair follicle. This, along with the heat energy absorbed directly by the hair follicle, damages the follicle and prevents regrowth. The SHR mode protects the epidermis and provides a virtually painless treatment. The sapphire tip on the handpiece provides contact cooling to the epidermis, preventing superficial heat injury. The Soprano XL's HR mode utilizes a single-pulse, high-fluence approach to deliver heat energy selectively to the hair follicle without affecting the surrounding dermal tissue. The energy absorbed by the melanin in the hair causes heat injury to the hair, preventing its further growth. Simultaneously, intense contact cooling is applied to the epidermis to prevent superficial heat injury and to improve patient comfort. Let's review the patient treatment procedure and system operation of the Soprano XL system step by step. We'll start with the SHR mode, which we recommend for larger treatment areas like the arms, legs, back, chest, stomach, underarms, and bikini line. The first step in the treatment procedure is evaluating your patient. Observe and document your patient's skin color, hair type, hair density, and the treatment area. Ask whether your patient was exposed to the sun within the last 3 to 4 weeks, since this is a contraindication to treatment. Discuss the treatment goals with your patient at the outset and establish realistic expectations based on the treatment area, her hair color, and hair type. If your patient has fine, light-colored hair, explain to her that it may take longer to achieve the desired results. Be sure to photograph your patient's treatment area before the first session in order to establish a baseline. It's important to rephotograph the patient before subsequent treatments in order to document the results achieved. Explain to your patient that during the course of the session, she may feel a gradual buildup of heat in the area being treated. Have your patient lie down, then shave and wipe clean the area to be treated. Using a red skin marker, draw grids of boxes approximately 10 by 10 centimeters or 4 by 4 inches in size on the entire treatment area. For large areas such as the chest or back, draw grids that are 5 by 10 centimeters or 2 by 4 inches. Apply a thin layer of pre-cooled ultrasound gel to a section of the treatment area that includes at most 4 grids, the maximum area to be treated at a time. Let's set the system parameters to start treatment. The SHR mode is preset to on. The pulse repetition rate is preset to 10 Hz. Set the fluence level to 7 to 10 joules per centimeter square based on your patient's skin color and hair. For skin type 6, use 7 joules per centimeter square. Confirm that the cooling button on the touchscreen has changed from gray to green, indicating that the contact cooling in the handpiece's sapphire tip is ready. Press the standby button in order to enter the ready state, and you're all set to go. For eye protection, the last step before starting the laser treatment is to ensure that the treatment room door is locked and that you, your patient, and anyone else in the treatment room has put on protective eyewear. The first step in the treatment is to apply the handpiece to the treatment area, ensuring that there is complete contact with the patient's skin. With your foot holding down the foot switch, press the trigger on the handpiece to initiate the release of energy, and, starting at the top right corner, immediately perform one pass of horizontal sweeping paintbrush movements over the treatment area. Then, release the trigger, reposition the handpiece at the top left corner, and perform one pass of vertical sweeps over the area. Repeat this until you have performed a total of 6 sweeps, 3 horizontal, alternating with 3 vertical. The sweeps should be performed at the rate of 5 centimeters or 2 inches per second, as demonstrated. Observe the treatment area for signs of skin erythema, parafollicular erythema, and possible edema. If these are apparent, you have reached the end point of treatment. You can reassure the patient that this redness and swelling is normal and will dissipate within a few hours. If these signs are not visible after 6 sweeps, as may be the case with fair skin or light hair color, immediately perform 2 more sweeps over the area, up to a total of 4 extra sweeps. Gently remove the ultrasound gel from the treated area and apply aloe vera gel to enhance healing. Apply ultrasound gel to the next 3 or 4 grids and continue treatment until you have completed the entire area. We will now review treatment of small areas on the face using the HR mode. Follow the same pre-treatment procedure as with the SHR mode. Evaluate skin and hair. Discuss realistic expectations with your patient, and photograph the treatment area. Explain to your patient that during the course of the session, he may feel a heat sensation in the area being treated. Following the same procedure as with the SHR mode, have your patient lie down on the treatment bed. Then shave and wipe clean the treatment area and apply a thin layer of pre-cooled ultrasound gel. Let's set the system parameters to start treatment. Select the HR mode on the touchscreen. Select the pulse type based on your patient's skin color and hair type. As you can see, the HR mode on the Soprano XL offers 6 different pulse types to accommodate a wide variety of combinations. Set the pulse repetition rate to 2 Hz. Set the fluence level between 35 and 45 joules per centimeter square based on your patient's skin color and hair type, hair color, and the area to be treated. Confirm that the cooling button on the touchscreen has changed from gray to green, indicating that the contact cooling in the handpiece's sapphire tip is ready. In the HR mode, to increase patient comfort, we recommend using the Zimmer Cryo 5 system to air-cool the treatment area. Mount the connector onto the handpiece tip and begin supplemental skin cooling. Press the standby button in order to enter the ready state, and you're all set to go. Remember, for eye safety, be sure to lock the treatment room door and have everyone in the treatment room, including the patient, put on protective eyewear before treatment starts. The first step is to apply the handpiece to the treatment area, ensuring that there's complete contact with the patient's skin. With your foot holding down the foot switch, press the trigger on the handpiece to initiate the release of energy, and immediately apply the handpiece in one slow movement over the treatment area at a rate of 2 centimeters or 3/4 of an inch per second. Unlike the SHR in-motion multiple pass technique, the HR technique is a single-pass treatment. Observe the treatment area for skin erythema, parafollicular erythema, and possible edema. Whether or not these endpoints are visible, no additional passes are performed. You can reassure the patient that any redness and swelling is normal and will dissipate within a few hours. Gently remove the ultrasound gel from the treated area and apply aloe vera gel to enhance healing. Instruct your patient that, in order to avoid hyper or hypopigmentation, he should apply sunscreen daily on the treatment area and abstain from sunbathing or a tanning bed for 3 weeks. He should also avoid saunas, hot baths, whirlpools, and other leisure activities which can increase skin temperature for a period of 2 days following treatment. We recommend avoiding clothing that is tight or coarse and likely to cause friction with the skin for 2 days following treatment. Your patient should expect to observe some normal shedding of hair in the treatment area within 7 days. Emphasize to her that if she observes any regrowth of individual hairs, she should not remove them by plucking, tweezing, or any other means during the entire course of treatment. For large treatment areas, the interval between treatments should be 6 to 8 weeks, while for smaller treatment areas, the interval should be 4 to 6 weeks. The average number of total treatments is between 6 and 8. Sessions are typically from 20 to 40 minutes long, depending on the treatment area. Treatment with the Soprano XL diode laser hair removal system produces visible results and a high degree of patient satisfaction. With the revolutionary SHR mode, treatment is gentle and virtually painless. There is no downtime for the patient, who can resume activities immediately after treatment. We at Alma Lasers hope that you have found the Soprano XL video helpful and wish you the best of success in treating your patients with the new Soprano XL system. If you have any questions related to our product, please feel free to contact our clinical support team. This video is intended as a supplement to hands-on training with a member of our clinical staff or an Alma Lasers authorized Soprano XL trainer.